Together we achieve victory over heart failure.
Hello, Namaste. I am Dr. Gobinda Prasad Nayak, consultant interventional cardiologist in Apollo Hospital, Bhubaneswar. Today we are delving into a silent epidemic that is India is combating, that is heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It is a common occurrence to witness young adults seeking medical assistance for heart failure. Unlike the Western countries, where heart failure is predominantly a disease of the elderly. So let's break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have heart failure? When people get a diagnosis of heart failure, they think it is the end of their lives. The term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently as it should. The ejection fraction, or simply called as EF, measures how well your heart pumps blood. It is the amount of blood pumped out of your heart's lower chambers, that is ventricle, mostly left ventricle, in each time it contracts. While a normal ejection fraction is around 50 to 70%, in individuals with heart failure typically have an heart ejection fraction of 30 or less. Secondly, why are so many Indians affected by heart failure? So the answer is genetics play a significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, smoking habits worsens this epidemic. So what are the signs and symptoms of heart failure? So the signs symptoms are fatigue, sometimes on of palpitations, nausea, exertional breathlessness, that may be class 1, 2, 3, 4, weakness, and there is also loss of appetite or vomiting. Again, patient may have swelling both lower limbs, abdominal distensions, like these are the signs and symptoms of heart failure. So how can we protect ourselves from this heart failure? Our hearts work incredibly hard to keep us alive. So these are the 5 golden rules we can follow to return the favor. First is yearly detection of heart failure through regular blood tests, then dietary adjustment to maintain heart health, then incorporating daily exercise into your routine, practicing stress management techniques, then quitting alcohol, tobacco, and smoking. So lastly, what comes next after a heart failure diagnosis has been done? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medications improve quality of life and longevity. Devices like biventricular pacemaker, implantable cardioverter defibrillator, that is called a ICD, and repairment of the heart valves or replacement of the heart valves. And the last resort treatment option is heart transplant. The lifetime risk for congestive heart failure is 1 in 5 for both men and women. Remember, awareness and proactive measures are the key in combating this silent epidemic that is heart failure. Thank you.